Today, we are going to review the essential steps for the priming and loading of the IV infusion sets for the Meridium 3860 MRI IV infusion system. We will focus on the Meridium 1058 IV extension set's components, and when to use the 1058 IV extension set. Additionally, we will provide step-by-step instructions on how to prime the set, install the set, and finally uninstall the set to reduce potential errors with the pump. Prior to attempting to prime and load a Meridium IV set, ensure that all 3860 system components are sufficiently charged. All components are powered on and communicating on the same wireless channel. Be sure to use a new sealed IV set within its expiration date. And please review the initial setup video if additional preparation information is required. Step 1. The 1058 IV extension set and its components. The 1058 IV extension set with its 10 milliliter priming volume is designed to easily connect to any standard hospital infusion set. The set components consist of a luer fitting, a clear alignment disc, a section of silicone tubing, a black flow preventer clamp, a roller clamp, and a needle-free wide port. The 1058 extension set has been manufactured with specific measurements designed to allow for a precise fit within the IV pump chamber. When handling the IV set, take care not to stretch the silicone tubing to ensure proper fit and flow rate during an infusion. Step 2. Priming the 1058 IV extension set. For all IV sets, once the IV set is primed, the user will clamp off the black flow preventer clamp. Be sure the black slide clamp is pulled all the way out past the flush position. The 1058 IV set will first need to have the female luer fitting attached to the pre-existing infusion set's male luer fitting. To prime tubing and clear air from injection sites, the user will slowly open the white roller clamps on the IRadimed 1058 and hospital infusion sets, allowing fluid to fill the tubing with gravity. The user will then invert and tap injection sites to clear any air bubbles while fluid is priming. Once the IV set is primed, the user will close the black flow preventer clamp. Be sure the black slide clamp is pulled all the way out past the flush position. Next, close the white roller clamp until the user has installed the IV set into the pump and are ready to start the infusion. Step 3. Installing the 1058 IV extension set. Although the Meridium IV sets may differ in their clinical applications, the method by which they are installed into the pump chamber is exactly the same. First, the user will open the easy latch door by simply pressing down on the purple button and lifting up on the silver handle. Next, the user will insert the alignment disc into the port at the top of the pump chamber. The user will gently snap the alignment disc into place. Be sure to take care when handling the IV sets that the user does not stretch the IV set's silicone tubing which loads into the pump's chamber. Stretching this section of tubing may prevent it from aligning properly along the peristaltic rollers and may cause an inaccurate flow rate. The user will then firmly grasp the flow preventer by placing their thumb on top of the clear arrow on the flow preventer clamp. Ensure the clamp is pulled completely out to the closed position. The user will insert the black flow preventer clamp into the lower port by pushing down on the spring-loaded platform and then in towards the pump in a down and in motion. Once the flow preventer is installed, do not push in the black flow preventer clamp, as this may open the clamp and allow a free flow of fluids. Next, the user will position the tubing into the bubble detector by gently inserting the tubing into place. As a best practice, it is recommended the user inspect the installation to assure the tubing is correctly loaded and properly aligned before they close the door and secure the latch. Be sure the latch is flush with the door to ensure the door is completely closed. Finally, the user will open any closed roller clamps to verify there is no fluid flow. The user is now ready to program an infusion. Step 4. Uninstalling the 1058 IV extension set. Once the infusion or the patient's MRI exam is complete, the user will disconnect the IV infusion set from the pump. First, the user will close the slide clamps or roller clamps to prevent free flow. The user will then open the pump's door. It is important to remember as the door opens, it will automatically clamp off the flow preventer, which accounts for the initial resistance the user feels upon opening. The user will then grip the black free flow preventer clamp like a handle and pull out and down to remove it from the lower port. The user will unseat the alignment disc, remove the tubing, and close the door. The Meridium 3860 pump is now ready for its next patient. For more information, visit www.iradimed.com. For technical support, please call 407-677-8022.